And we're going to hear from my colleague Heidi about that regulatory environment. Thank you very much. I'll be around to answer questions.
Thank you, Dr. Barthwell. That was excellent. That was a perfect introduction to our next panelist, Heidi Polek, who's going to be discussing more on e-prescribing and controlled substance, as well as the prescription drug monitoring program's mandates. So Heidi, take it away.
Thanks, Derek, and thank you, Dr. Barthwell. That was some incredible information. I've been a part of webinars like this for a number of years now, and that truly was, I think, one of the most powerful I've been on. Great information. Next slide, please. So I've been a pharmacist for over 30 years, and I happen to practice in a state where, it was one of the first to institute EPCS and PDMP. So I've been a part of this, for the majority of my career. And I can tell you over time, and speaking on webinars like this, it's really hit me in the heart, the overdose deaths that we are now seeing today. It is at an all-time high. You may have seen some reports out recently about the impact of the COVID-19 pandemic and the impact that it had on patients, limiting their resources for treatment. We are now at an all-time high. Next slide. This is a slide that I've actually spoken to a number of times, and when I first started speaking to it just a few years ago, the number on the slide, it started at 130, so that was 130 Americans a day were dying of opioid overdose. And over time, we were seeing that go down. It got into the 120s, so we were moving in such a positive direction. And then unfortunately, as I mentioned, COVID hit, treatment centers were shut down, patients were not able to get out and see people and meet with their organizations that were helping them through, what is understandably probably the most difficult time of their life. And we are now tragically seeing 190 Americans die each day from opioid overdose deaths. So the treatment options that Dr. Barthwell spoke about, they're extremely important that we get them in place and that we follow the regulations so that we can ensure that the patients get these medications in a timely fashion. If you're not e-prescribing, if you're not checking PDMP, there will be delays in therapy for your patients, none of which I know any on the call want. Next slide. So what is the rationale behind EPCS? As a pharmacist, it was something that I can tell you, I started in pharmacy, there were no computers, and then we got computers. And, every time there's been technological advancements in healthcare, workflow has improved. But there's also other things that this technology can help, one of which was very quick to come to pass was a reduction in fraud, waste, and abuse. Gone are the days when written prescription pads are stolen by patients, fake prescriptions are written and handed off. Believe me, they were very hard to catch sometimes, but I know by getting a prescription electronically, I have the highest level of confidence it is coming from an actual prescriber versus a written prescription. So it does reduce the misuse, not only of opioids, but other medications as well. Believe me, I could go on and on the medications that I saw misused. It reduces adverse events. I can actually read the prescription, and I'm sure for doctors, they appreciate being able to have legible text on a prescription as well. I think the two on the end, the provider efficiency and the patient satisfaction, are really, very important as well. Your staff will be much more efficient by sending prescriptions electronically, and patients are very satisfied with this. Think about it. You're going to be sending the prescription to the pharmacy before the patient leaves your office. It's going to get in the pharmacy workflow. The pharmacy can actually work on it before the patient gets there. If they catch an issue, they can call back to your office before the patient gets there. So problems can be solved before the patient actually gets to the pharmacy to pick up the medication. So there's really a lot of great benefits from using electronic prescribing of controlled substances and really electronic prescribing of any medication. Next slide, please. So how did EPCS come about? Well, it all started back in 2008. And I'd say for myself, not being a legal expert, but if you look at the timeline, things moved rather quickly to put this into place. Within, just a little under 2 years, we had the interim final rule published, and then it was effective, really within 2 years. And I can tell you in New York State where I practiced, it was very seamless to have the electronic prescriptions flow into the pharmacy. Like I said on the previous slide, workflows became easier for ourselves, for the doctor's office, and patients were they were very happy to get to the pharmacy and their prescription already be ready. You will note that in 2020, they did reopen the interim final rule. It's always good to go back and look at these types of rules that are in place to ensure that we're keeping up with technology and the needs of the providers and the patients as well. So it is open for comment, and we'll see where that goes. Next slide, please. During the COVID epidemic, there have been some waivers. You can understand that there's a lot of regulations in place with the DEA. In most cases, if not all, the patient has to be physically seen by the provider. They can't just be writing prescriptions without ever visiting with the patient. So there have been some waivers in place by the DEA that, relaxed some of the regulations so that doctors could see patients using telehealth. It also assisted with being able to prescribe over state lines. So, sometimes people got stuck in places where they didn't intend on staying because of lockdowns and things like that. So it was nice to see that the DEA was responsive and did put some waivers in place. They are still in effect. My recommendation to you is to always stay on top of any regulation. Always easy to go out to the DEA website, as well as other references that we'll discuss later in the webinar to ensure that you're meeting all the guidelines that are currently in place. But luckily, patients are getting the care they need while the COVID-19 epidemic is still in place. Next slide, please. There is a new mandate that is coming into place, and this one relates specifically to your Medicare patients. It was called the Support Act, and it is going to be effective. It's actually effective now, January 1 of 2021. The regulation requires that any prescription for a controlled substance for a Medicare patient must be electronically prescribed. The original compliance date where you had to actually start sending them was January 2022, just a few short weeks away. They did move out the compliance date to 2023. Any long-term care facility, it's 2025. But I can tell you, even though they've kind of kicked the can down the road, my recommendation is to don't wait. If you haven't already turned on the EPCS functionality within your AZZLY software, I highly recommend you get it in place now. I can tell you from past experience, and I'm sure everyone on the call, you know the challenges that you see as a new year comes for your patients. Patients are moving off of commercial plans and into Medicare plans. It's hard to tell when your patients are moving to Medicare plans. So don't get caught not being able to prescribe for a Medicare patient because you don't have the technology in place in time. And it's always great to get those things out of the way as soon as possible. So time to get ready for that. Next slide, please. This is one of my favorite slides. It really is a quick snapshot of where these mandates are already in place. You can see the majority of the country is orange, so there is some sort of EPCS and electronic prescription mandate already in place. And you've got some really big, powerful states coming into play in just a few short weeks in 2022. Those are the light blue slides: California, Washington, Utah, Michigan, to name a few. And then another one coming in 2023, and that'll be here before we know it. That's Illinois. And that one is of particular interest because not only is the mandate coming into place, but there will actually be penalties. This is the first of I've ever heard of something like this, but there will actually be penalties to the EMRs and the facilities who don't have integrated EPCS and PDMP in place. Luckily, you're covered here at AZZLY, working with DrFirst. That technology that you're going to need for those mandates is already in place. Next slide, please. So once again, I don't feel that we can stress enough the upcoming deadlines, especially the one coming January 2022. If you practice in any of the states listed, it's time to get rolling, to get the technology in place so that you can prescribe controlled substances. It's easy like a flip of a switch, but there are a couple things that do take some time, and your AZZLY rep can go over that with you to make sure that you have everything in place to meet everything by the deadline. DrFirst also has a great website. So next slide, please, that you can go to, and I'll show you that in a few minutes. So I want to talk a little bit about what a PDMP is. I know we throw out a lot of acronyms. I've said EPCS multiple times. That's Electronic Prescribing of Controlled Substances. You might wonder what PDMP stands for. That's a prescription drug monitoring program, and those are required by most states. Finally, the last one to put one into place was Missouri, and those are databases of, typically controlled substances. There's at least one state that requires every medication to be in the PDMP, but the PDMP is a great resource where a prescriber can actually see all reported controlled substance prescriptions. And as a dispenser, a pharmacy can also go view this information, and I can't tell you enough how helpful having that information is. And luckily at AZZLY, they have this type of information access integrated into the workflow so that as you're going to prepare the prescription, it's a click of a button to see this information. And I truly can't stress enough, even in the states where it's not mandated that the prescriber view it, in some it's just a recommendation, but as a practice, I would recommend that every prescriber view PDMP data before prescribing, and it is simply a click of a button within your AZZLY software, and you'll see that shortly. Next slide, please. So I talked a little bit earlier about the Illinois update, and I once again can't stress enough that it is extremely important if you do practice in this state that you put your solution in play before the deadline, which is January 2022, to avoid any type of fee. And you are covered here at AZZLY and DrFirst because we have the solution integrated for you. Next slide. Some PDMP successes, Pennsylvania, Tennessee, and Maryland are just a few of the states we wanted to show you where there is actually notable reduction in opioid prescribing. And I can tell you from personal experience in New York State, I saw a dramatic decrease when we went to the EPCS and actually an all e-prescribing mandate. We definitely saw a reduction in opioid prescribing as well as fraudulent prescriptions. So, these are pretty significant numbers. So if you're in a state where a mandate is coming, you too will be able to see these types of benefits. Next slide, please. Here's the website I was talking about. So DrFirst has this amazing interactive website, EPCSgold.com. We have interactive slides that will keep you updated on any requirement for your state regarding EPCS and PDMP mandates. So I highly recommend you kind of add this as a favorite, especially if your state mandate isn't quite into play yet. We keep this updated very regularly, so you can constantly go out and revisit it to make sure that you're compliant with all regulations that are in place. And it's a great, if you're considering expanding your practice into other states, you know, what a great place to go out and find the regulations that you need to follow. Next slide, please. Once again, some more states where all prescriptions need to be sent electronically. So if you're in any of these states, look at that. We've got California and Michigan coming up in just a few short weeks. And I can tell you, you know, I've been on some webinars with California dentists, and they are very quickly adopting solutions so they can ensure that they are prepared for the deadline. Next slide. More mandates by the numbers. We've got 34 states where e-prescribing is already mandated. 6 of the states require all prescriptions, and 8 are coming into play very quickly. So if you're any of those states that I kept showing, please, I can't recommend enough that you get with your AZZLY representative so that you too can be compliant by the deadline. Next slide, please. So in closing, just some best practices. It is absolutely a best practice to be proactive for any type of technology upgrade that you need. EPCS, PDMP mandates, they're just around the corner. Better to do it now than right before the deadline when you're scrambling, because you're already dealing with a lot of, you know, tough times here with your patients. So don't add another, you know, stick into the fire. Consult your state medical society as well as pharmacy board. They are always very up to date on regulations, especially the pharmacies. They're the ones receiving the prescriptions, so they're just as interested in remaining compliant with you in order to be able to fill the prescriptions for your patients. So they're a great resource as well. As I recommended, check your PDMP when you receive a new patient, when you're discharging patients, when you're doing any type of treatment review for your patients. I highly recommend that you check the PDMP. I found some very interesting information about my patients, and I was really able to work through some concerns of mine with the patients. And, you know, and when we did that, I worked with the prescriber and we got the patient the treatment that they needed. And really work out any workflow processes with your staff now. That's why going back to number 1, be proactive so that you can, all of your staff can be ready to go and you can mitigate any negative impact that it might have on patient care as you tweak your workflow to meet these new regulations. Next slide, please. Now I'm going to hand it back off to Derek, who's going to introduce our next speaker, Maria, for an amazing demo of the integrated EPCS solution.
Thank you, Heidi. That was fantastic. Really appreciate that. And I know everybody else did as well. We're going to go ahead and move on to our final panelist, which is Maria Gray. And Maria will go ahead and present her screen here in a few moments. And as we're throwing the screen over to Maria, oh, there it is. Perfect.